The Infection Prevention and Control Nurse Specialist at Royal National Orthopedic Hospital work in collaboration with your clinical teams to ensure your surgery and recovery is safe and effective. Before your surgery, you will be screened for methicillin-resistant Staphylococcus aureus, or MRSA, which is a bacterium that lives on our skin. You are found to be a carrier of this, do not worry. All patients coming into Stanmore are screened for MRSA as part of a national screening program. All patients are issued with decolonization treatment, even if they are negative. This is because it is found to be effective in preventing infection. If you are found to be positive, you will be required decolonization treatment and to be tested again until you have 3 negative screens. The decolonization treatment consists of chlorhexidine gluconate body and hair wash and mupirocin nasal ointment. The treatment lasts for 5 days. It is important that the liquid body wash is applied directly to your skin and not diluted. On day 1, 3, and 5, the hair wash is applied directly to your hair like a normal shampoo. The nasal ointment is applied 3 times per day to each nostril. If you have any queries about this, you can ask your pre-assessment nurse, your pharmacist, or GP. When the day of your surgery arrives, it is important that you have your decolonization therapy on the morning. Before your surgery, it is important to keep warm. You will be issued a foil blanket designed to keep you warm on your way to theaters. Please ask for assistance if you require it. While you are an inpatient, we invite you to use the hand hygiene facilities available. We advise you to clean your hands before eating and touching any invasive devices or wounds. Please also clean your hands after using the toilet and after touching any invasive devices or your wound. There are sinks in each bay and single rooms, alcohol gel at each bed space, and hand wipes available at meal times. If you would like assistance or extra hand wipes, please speak to your nurse. All staff will clean their hands before and after they see you.